Hello dear students, myself Bhavani Pentela, working as an assistant professor in Noida Institute of Engineering and Technology. Today I am here to discuss about the Pharmacology-I with a subject code BP404T. Today we are discussing the unit number 2, and in previous lecture I had discussed about the mechanism of drug action and principles of any drug action. In today's lecture we are going to discuss about the receptor theories, classification of receptor, regulation of receptors and drug receptor interaction. So, without any further delay we will dive into the class. Okay. So, before going to the receptor theories, what we had discussed in the previous lecture, in my previous lecture I had discussed about the mechanism of action and principles of drug action. In principles of drug action we had discussed about the stimulation, depression, dual action, irritation action, replacement therapy, antimicrobial effect or alteration in immune system. And after that we had discussed about the mechanism of drug action. In mechanism of drug action we had discussed about the two types. One is non-receptor mediated drug action and receptor mediated drug action. In non-receptor mediated drug action, here the drug will show its action through the non-receptor like physical action, chemical action, action through enzymes, action through ion channels and transporters. And what about receptor? Here the receptor is a site where the drug will go and bind to its receptor and it will show its physiological or pharmacological action. Either it may be competitive or non-competitive inhibition. There are some drugs which can inhibit the receptors by competitive and non-competitive. So, in today's section we will going to discuss about the receptor theories. So, there are several theories that where the drug has been here. There are several theories where we can explain the pharmacology of any receptors. Here the receptors theories has been classified into 5 categories. One is lock and key theory, second one is rate theory, third one is occupational theory, fourth one is two-state model theory and fifth one is induced fit theory. All these are the theories which we use it to explain the pharmacology of a receptor. So, now we will discuss about the first theory, lock and key theory. So, what is a lock and key theory? As the same like lock and key, every lock having its own key, right? In the same way every receptor having its own drug. So, if the false receptor and false drug, then there will be no pharmacological action. If you are talking about the lock, if I am talking about the lock, here the lock is a receptor. What is a key? Key is a drug. Same, every lock having, imagine the lock having its own key. In the same way the receptor having its own drug. Here the lock will act as a receptor and key will act as a drug. And if I am talking about here, for example, if you see the drug molecule must fit into the receptor. When you had administered the drug, this drug have to fit into the receptor to show its particular desired action. Then you can call as an intrinsic activity also. If you had taken the false drug will not go and bind to the particular receptor, then there will be no action or no biological action produced by the drug. So, this is about the lock and key theory. And next one is rate theory. So, what is a rate theory? The rate theory represents the number of drug receptor interactions per unit time. Here how many times the drug has been encountered to the receptor per unit time, you can represent or you can say as a rate theory. For example, if you have taken a drug and this drug go and bind to its receptor, then it forms a complex, and per unit time how many times the drug receptor complex has been produced, you can call as a rate theory. The number of drug receptor interaction per unit time will represent the pharmacological actions. How many times the drug receptor interaction has been produced per unit time will determine the pharmacological action. How the pharmacological action will be determined? The intensity of pharmacological action is directly proportional to the rate of association and rate of dissociation of a drug. How many times the drug has been associated to the receptor and how many times the drug has been dissociated from the receptor. This will directly proportional to the intensity of a pharmacological action. How can you say the pharmacological action of a particular drug? So, if there is more association and more dissociation of a drug, so the more pharmacological action you can expect, and if there is no association and no dissociation, there will be no pharmacological intensity of a drug. So, here what the rate theory represents, the number of receptor and drug complex formed per unit time can determine the intensity of a pharmacological action. The intensity of pharmacological action is proportional. It is proportional to the number of drug, like how many times of association and how many times of dissociation has been formed to the drug and receptor. So, if you see here, this is a receptor and this is a drug. So, how many times the drug has been associated to the receptor and how many times the drug has been dissociated to the receptor, this will represent the rate theory. So, this is in a drug. Here the drug will go and bind to the receptor, right. Here the drug will go and bind to the receptor. How many times the drug is going to interact with the receptor, how many times it is associating with the receptor and how many times it is dissociating the receptor per unit time, it will represent the rate theory. So, if the association and dissociation is the fast or more, then you can see the response, you can see the pharmacological response. So, in rate theory, what is going to happen here, the activation of receptor is directly proportional to the number or encounter of a drug to the particular receptor per unit time. If I am talking about the agonist drug, antagonist drug or partial agonist drug, how is the association and dissociation? So, now we will discuss about the agonist drug. If I had administered the agonist drug to the particular receptor, the association and dissociation will both are fast. For agonist drug, the fast association and fast dissociation you can be seen. And what about the partial agonist drug? When you had administered the partial agonist drug to the particular receptor, the partial association and partial dissociation you can be observed. And when you had administered the antagonist drug when it bind to the receptor, the association is fast, but the dissociation will be slow. Agonist, if you had administered the agonist, the association and dissociation both are fast, and in case of antagonist, association was fast, but not dissociation. And next one is occupational theory. So, in rate theory we had explained per unit time how many times the drug has been encountered to the receptor. In occupational theory, here the occupational theory, how many receptors has been occupied by the drug will represent the occupational theory. For example, here if after administering the drug, it will go and bind to its receptor. Okay, when it will shows its pharmacological action, the intensity of a pharmacological action will proportional to the number of receptors occupied by the drug. Okay, the number of receptors occupied by the drug will depends on where the number, how many types of receptors, how many receptors has been occupied, in which it will depend upon the dose of a drug and total number of receptor available on a particular tissue. So, this will represent the occupational theory. So, what is an occupational theory? Occupational theory, here the name represents occupation. So, what should be occupied here? The receptor should be occupied by the drug. So, the intensity of a pharmacological action you can determine by the number of receptors occupied by the drug, and number of receptor occupied by the drug depends on how much dose you had administered and how many receptors are available for the drug. For example, if you see here, this is a receptors, okay, this is a receptor. Here the receptor, how many receptors, here I had given an example 4 receptors, how many receptors has been occupied by the drug, that much physiological response you can be seen. For example, if this drug is not occupied to the receptor and this drug is also not occupied to the receptor, even this also not occupied to the receptor, only one drug has been occupied to the particular receptor, that much action you can be seen. And if the receptors has been occupied more by the drug, more pharmacological actions or more response you can be seen by the drug. And next one, here in occupation theory we will discuss about the two terminologies like affinity and affinity. So, what is meant by affinity and efficacy? So, here we will discuss about the two terminologies like affinity and efficacy. So, if I am talking about affinity, what it mean? Affinity, the ability of a drug that bind with the receptor to produce the drug receptor complex. What is mean by the affinity? Here it is in a drug. The drug having ability to bind to its receptor to form the drug receptor complex, then you can call as an affinity. And what is an efficacy? After once it bind to its receptor, it will produces the complexation. After complexation of a drug receptor interaction, it have to produce the desired effect, pharmacological action, then you can call as an efficacy, which sometimes you can call as an intrinsic activity as well. So, here see the diagram here, this is a drug, okay, and this is a receptor. When the drug go and bind to the receptor, how much affinity? When you can call the particular drug having a affinity, the drug having ability to bind its own receptor to form the drug receptor complex. If the drug is going to bind to its receptor and if it having ability to produce the drug receptor complex, then you can call as an affinity. Once the drug receptor complex has been produced and then to initiate the response, then it is called the efficacy. after the drug response, the ability of a drug receptor complex to produce or to initiate the response is called the efficacy. So, in occupational theory we had discussed about the two terminologies like affinity and efficacy. So, what is an affinity? The ability of a drug to bind to its receptor to form the drug receptor complex, then you can call as an affinity. And what is an efficacy? To initiate the response after of a complexation of drug receptor, then it is called as an efficacy. Okay, next we will see the two-state model theory. So, if you see the first picture here, receptor, this is an inactive state, and next one this is an active state. Here there is no drug, here I did not represent the drug, here there is no drug. Okay, here there is no drug in inactive state and active state. In both active state and inactive state there is no binding of a drug. Then what state it will be? It will be in a equilibrium state. If there is no drug occupied to the receptor, whether it is in active or inactive, the equilibrium will be exist. Okay. Next, what is the second diagram here? Here it is a receptor in inactive state, this is a receptor in an active state. Okay. So, here when the agonist drug go and bind to the active site of an receptor, then the equilibrium will shift to the active site. So, if you see here the equilibrium at a resting stage in an inactive or active state, if there is no drug, the equilibrium will be exist, right. And when the agonist drug has been administered, this is an agonist drug, when the agonist drug has been bind to its receptor, now the equilibrium will shift to the active site. And third picture represents the antagonist drug. Here it is an antagonist drug. Antagonist drug having capacity to bind for both inactive site and active site of a receptor. Once the antagonist drug bind to the inactive site or active site, what is the equilibrium? You can see there will be no change in equilibrium. The antagonist cannot change the equilibrium state of a receptor. And next one, inverse agonist. When you had administered the inverse agonist, it is going to show some opposite action. It is going to show some inverse action. Here the inverse agonist is a drug which will go and bind to the inactive site of a receptor, and it will shift the equilibrium to the inactive site, and it will show the opposite action. So, this is called then a two-state model. Here we will discuss about the when there is no drug, the both sides of a receptor will be shows equilibrium. When the agonist drug bind to its receptor, then the equilibrium will shift to the active site. When the antagonist bind to its receptor, there will be no changes in equilibrium. And when the inverse agonist drug go and bind to the inactive site of a receptor, then the equilibrium will shift towards the inactive site and will causes the action in a opposite manner. And last one, induced fit theory. So, what is an induced fit theory? Normally the receptor which you are imagining, like the receptor will not exit, will not pre-exit in a proper occupation theory. So, if I am talking about this induced fit theory, the receptor does not normally pre-exit in a proper configuration to bind to its drug. So, once you had administered the agonist drug, this agonist drug will changes the or it will alter the conformational changes of a receptor, and then it will allows the effective binding. Once the drug entering into the receptor, once the drug is going and binding to its receptor, there will be seen some conformational changes, and these conformational changes of agonist drug will elicit the pharmacological action. If it is an antagonist drug, and this antagonist drug will also produces the conformational changes to the receptor, but it cannot produces the pharmacological or biological actions. And next one is classification of receptors. So, what the receptors has been classified here, mainly the receptors has been classified into two types. One is the cell surface receptor and inside the cell receptor. The most of the receptors are the cell surface receptor like GPCR receptor, ligand receptor, ion channel receptor, for example, ion channel receptors, GPCR receptor, enzyme linker receptor. All these three receptors falls under cell surface receptor, and the only one receptor which you can name as nuclear receptor, which the receptors are present inside the cytoplasm, inside the cell, it means cytoplasm or inside the nucleus. So, the classification of a receptor, the receptors has been classified into the pharmacological criteria. According to the pharmacological criteria, the receptors has been classified according to the tissue distribution and according to the ligand binding and transducer pathway. So, by these four mechanisms of action of any drugs, it can classify the receptor. So, here what I am saying, what I am trying to say here, the receptors has been classified according to its pharmacological action, tissue distribution, ligand binding and transducer pathway. So, first one, pharmacological action. According to the pharmacological action of a particular receptor, it has been classified. For example, muscarinic receptor, nicotinic receptor, histamine receptor, dopamine receptor, serotonin receptor, H1 receptor, H2 receptor, D1 receptor, D2 receptor, D3 receptor, D4, D5. So, this will represent, it will show us its action by the physiological criteria the receptors has been classified. According to the tissue distribution, for example, here alpha. So, if I am talking about alpha, beta, for if I am talking beta, beta has been categorized into beta 1 and beta 2. Beta 1 of an adrenoreceptor which is present on the heart and beta 2 receptor which is present on the smooth muscle. So, depending upon the tissue distribution also the receptor has been classified. Third one is ligand binding. So, when the ligand binds to the particular receptor, according to that also the receptors has been classified. For example, serotonin receptor, it is in a large family of a receptor which has been classified into 5HT1 to 5HT7 and it having further subtypes of these serotonin receptors. And last one is the transducer pathway. If I am talking about this transducer pathway, here the transducer pathway, in sense here the receptor will shows its action by the GPCR, it will shows its action by the ion channels. For example, if I am talking about the acetylcholine, you know that acetylcholine is a neurotransmitter, it is a cholinergic drug, it having the two types of receptors, one is called as a muscarinic receptor and second one you can call as a nicotinic receptor. One receptor will act through the GPCR and another nicotinic receptor will act through the ion channel. The drug is the same, the drug is the acetylcholine. So, it will shows its action according to its transducer pathway. If this acetylcholine go and bind to its muscarinic receptor, then the GPCR will be get activated. And this acetylcholine when the go and bind to the nicotinic receptor, then it will shows its action through the ion channel. And the best example, or the second best example was the GABA. So, if I am talking about the GABA, it has been further classified into GABA A, GABA B and GABA C, and here the GABA B will act as an GPCR and the GABA A and GABA C, it will shows its action by ion channel. And next one, receptor regulation. So, here the receptor regulation has been classified into two types, one is upward regulation and second one is downward regulation. So, what is an upward regulation and what is a downward regulation? First I am discussing about the upward regulation. If the antagonist drug has been chronic exposure to the particular receptor, the chronic exposure of an antagonist drug to the particular receptor, then you can call as an upward regulation or you can call as an super sensitivity of an cell. Okay, here the more receptors, what is going to see in upward regulation, the more receptor, more the cell response. How many receptors are present? According to that, the more response you can see with that receptor. Okay, what the drugs are going to show? The upward action antagonist drug with the chronic exposure to the particular receptor. What is a downward regulation? When you can call a particular receptor showing the downward regulation? When the agonist drug has been chronic exposure, the chronic exposure of an agonist drug to its receptor, then you can call as a downward regulation or you can call as a desensitization. So, downward regulation, the second terminology was a desensitization. Here the chronic exposure of an agonist drug to the particular receptor will desensitize the receptor. It is going to diminish the action of a receptor, and this in downward regulation you can see the two terminologies like a tachyphylaxis and tolerance. Once the receptor has shows the downward regulation, here the sensitivity of a receptor has been decreased, then the receptor will cause the tachyphylaxis or tolerance. So, here I am discussing about upward regulation. For example, if you see here in upward regulation like a beta 1 adrenoreceptor, in beta 1 adrenoreceptor, here the upward regulation, here if I am talking about the receptor was beta 1, okay, beta 1 adrenoreceptor will shows the upward regulation at the hyperthyroidism condition. Here I am talking about the condition, the receptor adoption caused by the events, but not the drug. Here the drug not will place any action, the event will place the major action to show the upward regulation or downward regulation. For example, if I am talking about the upward regulation, so upward regulation, the beta 1 adrenoreceptor will show the upward regulation in which event? In hyperthyroidism, and it will show the downward regulation in which event? In hypothyroidism condition. And what is the second example here? Next one, beta adrenoreceptor, it will shows upward regulation in alcohol withdrawn condition. In upward regulation, and the same beta receptor it will shows the downward regulation in the myeloid leukemia. So, in myeloid leukemia condition, myeloid leukemia event, it will shows the downward regulation. Okay. And next one, sometimes the upward regulation has been seen with the hormones also. So, here I had discussed about the two hormones, one is estrogen and second one is the progesterone. Which type of hormones it are? These are the female hormones, female sex hormones, the estrogen and progesterone. The estrogen is a hormone which will induce upregulation of alpha adenoreceptor, and this progesterone will induce the upward regulation of the beta 2 adenoreceptor in the uterus. Okay, so estrogen is a drug which will induce the upregulation on alpha adenoreceptor, and progesterone is a drug which will induces the upward regulation on the beta 2 adenoreceptor in uterus. Okay. So, here there are the some drugs which will falls under the downward regulation. There are the some drugs how the downward regulation will desensitize the cell and how it will causes the tachyphylaxis and tolerance. So, this is in a table here I had framed the example isoprenaline. So, isoprenaline is a drug, which type of drug it is an adrenergic drug. So, this adrenaline, when you had administered the isoprenaline, it will go and bind to the beta 2 adrenoreceptor in the bronchial muscle, and here this isoprenaline will shows the downward regulation. So, here the receptor sensitivity will get decreased, the receptor, so downward regulation can called as a desensitization. Here the receptor sensitivity has been decreased. Once you had administered the salbutamol drug, so the action of a salbutamol also decreased in the particular asthmatic condition. Okay. Next one, levodopa. If you are administering the levodopa, here the receptor will shows the downward regulation, and the sensitivity of a receptor will be get decreased, and after some time it will shows us the tolerance, and it will decreases the therapeutic effect, particularly in the Parkinsonism disorder. Next one, morphine. The morphine is a drug which will go and bind to the opioid receptors, and it will shows the downward regulation, and which will causes the tolerance effect after the receptors has been desensitized. And next one is diazepam drug, which will go and bind to the benzodiazepine GABA receptor, and it will shows the downward regulation. It will desensitize this GABA receptor, and it will decreases the sedative action for what the drug you had been administered. So, by this slide I have to say you that by the downward regulation the receptor sensitivity will get decreased. So, by decreasing of these sensitivities, sometimes the drug will causes the tolerance or tachyphylaxis, sometimes the action of a particular drug will get diminished. And drug receptor interaction. So, the drug receptor interaction, what is a drug receptor interaction? Before discussing about the drug receptor interaction, now we will split the terminology. What is a drug, what is a receptor, and what will happen when the drug receptor interact. So, what is a drug? Drug is a single active chemical or a compound, when it has been administered, it will shows the action. It won't alter the function, it won't alter the function of a system, it will alter the ongoing action, right. If when you can use the drug, the drug has been used for the diagnosis, prevention, treatment, or to cure a disorder. So, okay. And what is a receptor? Receptor is a protein, it is a macromolecule, it having the binding site which is present inside or outside of a particular cell. Once the chemical molecule enter into the receptor, or when the chemical molecule come contact with this receptor, there will be some physiological changes has been happened after binding drug to the receptor, and the changes you can term as pharmacological changes or desired effects or undesired effects. Without drug receptor complex, there will be no action will be addicted. And here I have to say you one thing, the receptor itself do not having any function. The receptors which are present in our body do not having any function. When the drug come and bind to its receptor, then only it will show its action. The drug have to come and bind to the receptor, and the drug receptor complex have to be produced, and later on it will elicit the pharmacological action. So, here you can see the diagram, this is a drug, this is a receptor. When the drug bind to this receptor, what is going to happen? Drug receptor complex. If there is no drug, and only receptor will be available, then there will be no pharmacological action produced by the particular receptor, because the receptor do not having any action. If there is the drug, you had administered the drug, but if there is no particular receptors for the drug, then how it can shows its action. So, every drug having its own receptor, which I had explained in a lock and key theory. In the same way, the drug having its own receptor, this drug when bind to the receptor, it will form the complex which you can call as a drug receptor complex to produces the physiological or pharmacological action. See here the drug, when it interact with receptor, what is going to produce? Drug receptor complex, and this drug receptor complex will elicit the pharmacological response. And now we will see the drug receptor interactions. The drug receptor interactions has been classified into agonist and antagonist, and agonist drug has been further classified into full agonist, partial agonist, inverse agonist. And what about antagonist? Antagonist drug has been classified into reversible, irreversible. Irreversible in turn further classified into competitive and non-competitive. So here we will discuss about the full agonist. So what is then a full agonist? Here the affinity of a drug is more. You can see the intrinsic activity. Here the agonist will increases the activity of a receptor and it will produces the maximum response. And partial agonist, here the drug having the partial affinity to bind to its receptor and partial response you can see in here. And what about the inverse agonist? Here the inverse agonist is a drug which will decreases the activity and which will produces the opposite action of a drug. So here if you see here the affinity plus intrinsic activity, and in partial agonist you can see the affinity plus a sub maximal intrinsic activity, and here in inverse agonist you can see affinity but no intrinsic activity. Antagonist drug there will be the zero intrinsic activity, and here we will discuss about the reversible, irreversible. So what is in reversible? Here we has been classified into competitive and non-competitive. In previous slide I had explained you competitive means here the drug go and bind to the catalytic site of an receptor and it will shows its or it will inhibit its action. Competitively it will inhibit its action, right? And non-competitively, apart from that catalytic site, it will go and bind to the any site of an receptor and it will inhibit the action of an receptor. And next one is irreversible. Irreversible, it may or may not compete with the catalytic site of an receptor and it will produces irreversible action. Thank you.